Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This video is on getting pregnant. Children are amazing, aren't they? Having children and raising them can be one of the greatest things that you ever do in your life, and it all starts with pregnancy. If you're thinking about becoming pregnant, you're going to want to maximize your chances of conceiving, and you're going to want to take steps to make sure that you have a healthy pregnancy and a healthy baby. So this is a really important topic that you need to know about. We're going to be covering lifestyle changes to begin before you start getting pregnant, strategies to maximize the chance of conception, and we'll also go over when you should seek evaluation or treatment with a fertility specialist. Now, if you like topics like this, be sure to subscribe and leave a comment down below letting me know what health topics you'd like covered in future videos. In addition, if you have any questions, leave them in the comments and I will answer all of them. Now, before we get started with getting pregnant, remember that these videos are for educational purposes only. I cannot give personalized medical advice here. So if you're having symptoms or if you're thinking about becoming pregnant, make sure that you talk to your doctor. Now, let's get started with getting pregnant. If you're a woman and you've decided that you want to become pregnant, there are lifestyle changes that I want you to begin right away. You want to take care of yourself in order to make sure that you have a healthy pregnancy and a healthy baby. The first thing I want you to do is to eat healthy. Lots of fruits and vegetables, and avoid overeating. It's important to start doing this now, long before you get pregnant. In addition, I want you to exercise on a regular basis. The guidelines are that when you become pregnant, you want to continue the exercise program that you've already started. On the other hand, while pregnant, that's not a good time to begin a new exercise program, especially one where you might get injured. So before getting pregnant, begin an exercise program, something that's fun and safe, and plan on continuing that during your pregnancy. It's important that if you're thinking about becoming pregnant, there are certain things that you want to avoid. No smoking, no alcohol, and no recreational drugs. These can be poisonous to a developing fetus, so it's really important that you avoid those activities if you're thinking about becoming pregnant. Something else that's important for you to do is to take a prenatal vitamin. In particular, a prenatal vitamin has higher levels of folic acid, which is really important to avoid specific complications during pregnancy, such as spina bifida. There are other ways that I want you to take care of yourself if you're thinking about becoming pregnant. For one thing, I want you to get plenty of sleep. Healthy sleep is a crucial aspect of health for every system in your body, and it's certainly important if you're trying to become pregnant. In addition, I want you to manage your stress. We all get stressed sometimes, but it's important to manage your stress in a healthy way, especially if you're trying to get pregnant. Also, if you suffer from chronic illnesses, such as thyroid disease or diabetes or high blood pressure, it's important to work with your doctor to get those chronic illnesses under control before you decide to become pregnant. In particular, make sure that your doctor knows that you're trying to get pregnant. That way we can make sure that any medicines that you're taking are safe to take while you're pregnant. What about tips for men? If you're a guy and you'd like to become pregnant with your partner, some things that I'd like for you to do are to eat healthy, exercise regularly, don't use tobacco products, avoid recreational drugs, and limit your alcohol intake. Now, you've decided that you want to get pregnant with your partner. What are some strategies to maximize your chance of conceiving? The first question that you want to ask is, do you want to track your cycle to figure out when you're ovulating? If day 1 of your cycle is when your period begins, ovulation typically happens around day 14 of your cycle, but this varies a lot from patient to patient. Ovulation is the time in your cycle in which you are most likely to become pregnant. There are different ways that you can estimate when ovulation is occurring. You can use a calendar. You can check your body temperature at various times in the month because you will see a mild spike in your body temperature during ovulation. You can also use ovulation test kits, and you can purchase these at grocery stores and at pharmacies. These test kits measure the amount of estrogen and progesterone in your urine at different times of the month, and this can be used to estimate when you're ovulating. If you use any of these methods and you've estimated when ovulation is occurring, then the strategy is simple. You should maximize intercourse during the days around when ovulation is occurring in order to maximize the chance of conceiving. What if you prefer not to track your cycle and estimate when you're ovulating? In that case, a great strategy is to have intercourse with your partner every other day. This is an ideal frequency to maximize the chance of conceiving without needing to track your cycle. Some other things that I want you to consider if you and your partner are trying to conceive. Number one is that there is no sexual position that has been proven to increase the chances of conceiving. So you and your partner should do what's the most fun for you. Number two is that there is no time of day that has been proven to maximize the chance of conceiving. So you and your partner should have intercourse when it's the most convenient for the two of you. And finally, there is no supplement that has been proven to increase the chance of conceiving. If there were, I would recommend it to you right now. But yeah, there's no supplement that's going to help there. Now, what about advice for men? If you're a man and you're actively trying to conceive with your partner, here are some tips that I recommend. Stay hydrated, avoid masturbating during this time, and stay inside your partner for at least 15 minutes after ejaculating. These are all great strategies to maximize your chance of conceiving. Now let's talk about infertility and knowing when you should see a fertility specialist. The definition of infertility varies based on how old the woman is who's trying to conceive, and this varies a lot from person to person. In general, fertility tends to decrease as we get older. If you are under 35 years old, then infertility is defined as trying to conceive with your partner for at least 1 year, and it hasn't happened yet. If you're at least 35 years old and you've been trying to conceive for at least 6 months, then that is also infertility. Finally, if you're at least 40 years old and you're trying to conceive, then the period of time is even shorter. And in fact, if you're at least 40 years old and you'd like to conceive, you might want to go and talk to your doctor from the beginning to see if being evaluated by a fertility specialist is right for you. Something else that I want you to consider. If you're a woman trying to get pregnant and you have irregular menstrual cycles, or if you suffer from certain chronic illnesses, such as polycystic ovary syndrome, or endometriosis, or thyroid disease. These are conditions that can decrease one's fertility. So in those cases, you might want to consider being seen by your doctor sooner and consider an evaluation with a fertility specialist. If you and your partner have been trying to conceive for a while and it hasn't happened yet, then you may be suffering from infertility. And the infertility could be because of the man, because of the woman, or because of both of you. At this time, it's a good idea to go and see your primary doctor or a fertility specialist, and they will order tests to investigate what might be going on. For women, we will assess the reproductive organs through physical exam, through laboratory testing, including hormone tests, and imaging studies. For men, we will typically perform a semen analysis, and we may also check the blood levels of testosterone. In certain cases, for men and women, genetic testing may be performed to look for specific genetic causes of the infertility. Depending on the results of this infertility investigation, you and your partner may decide to undergo specific treatments in order to achieve conception. And these include IUI and IVF. IUI stands for intrauterine insemination, and this is a procedure that maximizes the chance of fertilization occurring inside of the woman. IVF stands for in vitro fertilization, and this is more complicated. This involves collecting the semen from the man and the eggs from the woman, achieving fertilization inside of a laboratory, and then the fetus being inserted into the woman, where the fetus will gestate for the rest of the pregnancy. That's it for today. Thank you for watching. Be sure to subscribe and leave a comment below letting me know what health topics you'd like covered in future videos and if you have any questions. Remember, these videos are for education purposes only, so if you're thinking about becoming pregnant with your partner, make sure that you go see your doctor. Bye-bye.